I joined NSPPD. I joined the prayer altar in 2023, and since then, my life took a different turn. I relocated to the UK without £1 being included for my end. God miraculously did it. And when I got there, I found favor from all sides, from men, women. I was highly favored. I did not struggle to get a job. And even I wanted to work with the NHS, and I applied for the job. And in the job description, they clearly stated you need a minimum of 3 years experience in the NHS. And Pastor said on the altar that you may not be qualified, but you will be the preferred one. And I applied for the job and I got called for an interview. I requested to do the interview virtually and they agreed. And the interview was more like a discussion. And usually for NHS interview, they would get back to you in a day or two because they have to interview everyone. And immediately after the interview, about 15 minutes later, they called me and offered me the job, just like that. And it has been smooth sailing since then. And my second testimony, once I relocated, I started experiencing heavy bleedings, menstrual bleeding. At first, it would last for 2 weeks, and then it gradually increased to 1 month. And I could bleed for 2-3 months consecutively. I'm talking about heavy bleeding. And I would stop bleeding for about 5 days and then to continue. And I kept on praying on the altar, I'm expecting my delivery, my healing. And gradually, I started feeling severe abdominal pain. I had to go to the emergency unit, the emergency department. They arranged for me to have an urgent ultrasound scan. And that was when, because I work in the radiology department, and then she told me that they found polyps in my uterus. And that was the cause of the heavy bleeding and the abdominal pain. And they said I would have to wait about 4-5 months before seeing a consultant. And I kept on staying on the altar. Pastor repeatedly mentioned ovarian cysts, several cases, and I just kept on keying into that. And I finally got called to, and they told me I would have like a surgery done, hysteroscopy, where it's an invasive surgery where the polyp would be operated on and cut out. And they gave me a date and counseled it, and they finally gave me a date. And on the day of the surgery, while I was on my way to the hospital, Papa said, what they saw before, they would not see it again. And I work in the radiology department. I have seen my ultrasound scan, the report. I knew the polyp was there. And I went to the office. The consultant asked me, do I know why I was here? I said, yes. He explained what was happening. And I asked him, after the surgery, what is the chance of this reoccurring again? And he said he's not sure. It's a 50-50 chance. And then they administered local anesthesia. They had to check me before the procedure starts. And then they examined me through the camera, and nothing was there. He told them to increase the water pressure so he could see clearly, and nothing was there. He went back to my ultrasound scan reports, the imaging. We could clearly see the position of the polyp. And he went back to the system. They were examining my interiors, and nothing was there. And he called me. He asked me, do I know what happened? I said yes. And then he said he would refer me for a second ultrasound scan just to make sure. And the second ultrasound scan I did, there was nothing there. Wow. Everything was brand new. And this happened in October. And I said I was going to come down to give my testimony because it's easy to hear people testify for several cases, but it's one thing when this personally happens to you. Bleeding for long months. In the Bible, the woman with issue of blood had that for 12 years. And I just had mine for a few months. I know how that affects your whole life. So I just want to thank God for his miraculous healing. And since that day, since the 16th of October, I have not bled. Everything is back to normal. And I can go about my life joyful. I just want to glorify the name of the Lord and thank God for his healing. Praise the Lord.
What our God cannot do,